Have you been struggling with fatigue, insomnia, headaches, and all of your blood work has been coming back normal? Well, you might be missing an essential nutrient, magnesium. Many people are deficient in this mineral and don't even know it. In this video, I'm going to break down the 7 common symptoms of low magnesium, why so many people have low levels of magnesium, the best food sources of magnesium, how to test for it accurately, and stay tuned till the end where I will go over the different forms of magnesium and which ones are the best for certain conditions. Hi, I'm Dr. Var. I'm a double board certified family OPC medicine and I'm certified in functional medicine, and I help people find the underlying root cause of their chronic symptoms and disease so they can reset their health and reclaim their life. All right, let's dive in. Let's start with how you know your magnesium is low in the first place. Here are the top 7 symptoms that most people ignore. Number 1 are muscle cramps or twitching. Magnesium helps your muscles relax by regulating calcium flow into the muscles. If you don't have magnesium, you don't get this relaxation and your muscles can't properly relax after contracting, leading to cramps, spasms, and twitches. Number 2 is fatigue and low energy. Magnesium is needed in order for your mitochondria, which are your little energy producers of each cell, to make your energy molecules called ATP. So if you're low in magnesium, you're not going to be able to produce as much energy, leading to fatigue and exhaustion. Number 3 is insomnia or sleep disturbance. Magnesium helps regulate your parasympathetic nervous system. This is the nervous system that helps you relax and get ready for rest. Magnesium also helps in the production of melatonin and also GABA, which is a neurotransmitter that helps you relax and helps you sleep better at bedtime. Number 4 are headaches and migraines. Magnesium deficiency causes vasoconstriction of your blood vessels, so there may be less blood flow, which then can result in headaches. Magnesium also plays a role in the balance between serotonin and glutamate. Serotonin is very relaxing, whereas glutamate is more excitatory. And this may cause increased sensitivity of your pain pathways, thus causing the brain to be more sensitive to headache triggers causing migraines. Number 5 is depression. Magnesium plays a role as far as your stress pathway, your cortisol, and something called the HPA axis, which helps regulate your cortisol hormone. So if you have low magnesium, you're going to have higher cortisol, and you might be more sensitive to stress, which then can cause anxiety and depression. Number 6 is irregular heartbeat or palpitations. Magnesium is essential for maintaining your electrolyte balance, especially your potassium and calcium. So if you're low in magnesium, this regulation may be impaired, and this can cause more palpitations. In fact, if your potassium is low, we usually will check a magnesium because low magnesium can cause low potassium. Number 7 is sugar or chocolate cravings. Magnesium is required for glucose metabolism, insulin signaling, and energy production. When your levels are low, you might be looking for quick sources of energy, and sugar is one of those quick sources. And you may even find that you crave chocolate, especially dark chocolate, because that is one of the richest sources of magnesium. Magnesium deficiency is becoming more and more common, and it's not because we're not eating enough of it. It's because modern life is draining it. We are more stressed than ever, and stress can definitely deplete your magnesium and cause your cortisol levels to go up. And then what happens is the more stressed you are, the more demand you need of magnesium. If you're already low to begin with, and then low levels increases cortisol, you're stuck in this vicious cycle. We also are on medications that may lower our magnesium, such as diuretics, acid reducers, and even birth controls can cause low magnesium over time if you're on these medicines chronically. We also consume more alcohol and caffeine than ever to deal with our stress and to deal with our fatigue. And that can also lower your magnesium. And then even if you are eating vegetables that are high in magnesium. We're finding that our soils are being depleted of magnesium naturally, such that our produce is lower in magnesium than it was years ago. So even if you're eating these foods, you're not getting enough because it's simply not there. Now that you know the symptoms and the reasons why your magnesium may be lower, let's talk about how you can build it back up. The best thing is to try to incorporate more foods, but you have to eat from several sources to make sure that you're getting enough. And these foods all are rich in magnesium. I mentioned dark chocolate, so have a dark chocolate square every day. It also has good antioxidants, which are good for your heart and other organs. Dark leafy greens, I would get at least 1 to 2 cups of a dark leafy green such as spinach, kale, or Swiss chard, and 1 cup of cooked greens has about 160 milligrams of magnesium. Avocados, not only are they a good source of a healthy fat, they also are higher in magnesium and potassium. 1 medium avocado has about 60 milligrams. Fatty fish, such as salmon, mackerel, and halibut are also good sources. Grains, such as quinoa, brown rice, and oatmeal have moderate amounts of magnesium. And legumes, such as black beans, lentils, and chickpeas have some magnesium in them as well. So you want to get a variety of these food sources so that overall you'll be able to eat enough foods that have magnesium in them that it'll help maintain a good level. How do you know if you are low in magnesium? The standard test that most doctors check, if they do check a magnesium, is a serum magnesium. The problem is the serum magnesium only checks the amount of magnesium that's in your blood, not in your cells. And only about 1% of your magnesium is actually in the blood. So it doesn't really give you an accurate picture of what your stores of magnesium are and whether or not you're deficient or not. There is a better test called a magnesium RBC. The magnesium RBC is a better predictor. It is actually looking at how much magnesium is stored in your bones, your muscles, and inside your cells, where the serum magnesium is not. Your serum magnesium is always being maintained, even if you're severely deficient elsewhere. It's like having cash in your wallet, but not having enough money in your bank. The cash is like the serum magnesium, and what's in the bank is like the magnesium RBC. Although you may have enough in the moment, you may not have enough reserves to maintain it overall. All right, so if you're eating a good diet, you get your magnesium checked and your levels are low and you're having symptoms, what kind of supplement should you take? There are many magnesium types of supplements, and I get this question all the time, is which one is better to take? So it just depends. Some forms are better for certain conditions than others. Magnesium glycinate is a very common one. Magnesium glycinate is bound to an amino acid called glycine, which helps it get absorbed better. It's excellent for sleep, anxiety, and even muscle issues if you're getting some muscle cramps. It also doesn't seem to have as high of GI side effects like you get with other magnesium supplements where they can cause loose stools. Another form that's one of my favorites is magnesium l-threonate. This is the only form of magnesium that can cross the blood-brain barrier. It can actually help your brain cells and may even help cognition and focus. Then we have magnesium malate. This is bound to malic acid, which is involved in energy production. So it helps with fatigue, muscle cramps, and muscle pain. And so it'll help conditions like fibromyalgia. There's also magnesium taurate, which combines magnesium with taurine, which may help your heart health and blood pressure regulation. If you have some cardiovascular concerns or palpitations, then this form of magnesium may be good for you as well. Then we have magnesium citrate. This is commonly used for constipation. It will cause loose stools. So if you have constipation and you're having some other symptoms of low magnesium, then this may be a good form for you to take. And then we have magnesium oxide. This is the form I would avoid if you feel like you have a magnesium deficiency, because Magnesium oxide does not get well absorbed into the blood and your cells. It primarily stays in the colon, so it's good if you just have constipation. But if you're actually trying to treat a magnesium deficiency, then I would avoid magnesium oxide. Now, the unfortunate thing is a lot of magnesium supplements actually have magnesium oxide as the predominant form because it is very cheap. But if you're specifically looking for a magnesium supplement to help with these deficiency symptoms, you're wasting your money if you buy a magnesium oxide supplement. Of course, you also want to check with your doctor to make sure that you can take magnesium in the first place, because you don't want to get too much magnesium. So if you don't need it, you don't want to take it at a higher dosage, because too much magnesium can be harmful as well. So make sure you check with your doctor to ensure that you are taking a safe amount. And some people are so depleted that they might even need a higher amount, but you should definitely work with your doctor to determine the dosage and also discuss which form might be best. All right, so I hope this video was helpful in clearing up some of the confusion about magnesium. Please share this video with someone you think might benefit, and don't forget to subscribe for more functional medicine tips, and have a fantastic day.